So the continuation of this Omaima notes from this page. Now we can see which of the level of spinal cord that cause hyperreflexia upper neuron lesion. Upper neuron lesion T12L1, the most higher level before ending the spinal cord L1. So this is the T12L1. Common root values reflex in dermatome. These are important. Ankle dorsiflexion. This is ankle dorsi. Ankle plantar. Ankle plantar S1. Dorsi L5. These both are L5. Big toe extension is L5. Ankle plantar S1. Little finger thumb 6, 7, 8. 6, 7, 8. Nipple, level of nipples 7, 8. This is 6, this is 7, this is 8. Level of nipple is 4. This is 4. Inguinal canal T12. This is inguinal. Level is T12. Anesthesia given at T12. Ureteric stone L23. Lion 2. This is lion to groin L1, L2. Knee front. Now knee front sciatic nerve shoulder C5. Skin sensation is C5. Now knee, this is L3. Knee L3. Medial side of the ankle, this is 5, L5. This is S1, sural nerve. Fluid distribution in the body: intracellular 2/3, that is 28 liters. Extracellular is 1/3, around 14 liters, as follows. Then 14 is distributed as 10 liters in interstitial and 3 liters plasma transcellular. Main coagulation pathway. What is the main coagulation pathway? It is extrinsic pathway. And what are the main factors of extrinsic pathway? It's from the tissue thromboplastin 3, 7. Warfarin is acting. Prothrombin time. Extrinsic pathway. Prothrombin time. Common pathway. Intrinsic pathway starts from 12, 11, 8, 9. 12, 11, 9, 8. Then 10 is there. APTT. Intrinsic. Longer pathway. Common pathway 10, 5. Forms clot fibrinogen, that is fibrin is factor 13. Patient with parasite allergy IgE. Respiratory surfaces A. Immune response immunoglobulins. Patient immune response immunoglobulin first to come is M. Pentamer, it is also called as pentamer. Second, then comes G. Classical complement cascade is C2, C4B. Alternative complement is C3. Classical C24. Alternate is alternate B, C3B. 3 and 5. 2 and 4 is classical. Even, odd is alternative. T cell mediated is cytotoxic helper. T cell mediated helper suppress B cells. Humoral is B cell. Cell cycle phase. First is synthesis, Then mitosis. G1 is rapid growth, G2 is preparation for division. Cori cycle happens in erythrocytes, which 6 ATPase hepatocytes, 2 ATP glucose converted to pyruvate and lactate ATP is released. Cell membrane passive transport oxygen by simple diffusion, water by osmosis, where glucose by facilitated diffusion. Electrolyte sodium potassium pump is an example of active transport. This question. Patient has pyloric excess ometic metabolic alkalosis. Decrease potassium, hypokalemia, increase pH, hypokalemic alkalosis. Ischemic bowel disease, acidosis. Pulmonary embolism, alkalosis. Respiratory alkalosis, hyperventilation because of hypoxia. COPD, asthma, opioid poisoning, respiratory acidosis. CO2 is increased, retention is there, and compensatory bicarbonates are increased. Diabetes mellitus, metformin should be stopped 2 days before metabolic acidosis because of lactate. Cushing tried, increase intracranial pressure increase causes increased BP and hypobradycardia and bradypnea. Respiratory rate decrease because this is because of vagal stimulation. This is hypertension is because of systemic sympathetic stimulation. Patient touch oven and felt the heat pain. Which fiber? Pain C fiber. Patient immediately sense cold ice. Remove his hand fast. Delta fibers are fast. Posterior pituitary hormone vasopressin and oxytocin, also called as ADH. The main determinant to cerebral blood flow is intracranial pressure. So calculate ICP, intracranial pressure, cerebral blood flow is equal to mean arterial pressure minus ICP. Mean arterial pressure is systolic blood pressure plus 2 into diastolic blood pressure divided by 3 minus ICP. That gives the intracranial pressure. Intracranial increase after trauma, so decrease by decreasing mean arterial pressure. What is physiological process to decrease intracranial pressure? Hyperventilation. Whenever you are doing hyperventilation, there is CO2 washout. So that causes hypocapnia. This leads to decrease intracranial pressure. Ventilation. What hormone increases extracellular fluid? This is antidiuretic hormone or vasopressin, acts on retention of water plus sodium is taken inside, potassium out, increases extracellular fluid. Hormone decreases with hyperthermia. TSH. Whenever there is increased temperature, hormone increases water and bicarbonate secretion. Water and bicarbonate secretion from pancreas. This is from pancreas, that is secretin, VIP. Most common responsible for quiet respiration is diaphragm. Lung compliance increases, emphysema, head up position, hypovolemia, decreases in fibrosis. This is all obstructive. Fit up lithotomy, hypoventilation, general anesthesia. JVP increases in expiration, exercise, lying supine, severe vena cava obstruction, increase intrathoracic hypervolemia, decrease in inspiration, hypovolemia. Gas exchange at which level? Alveoli. Which lung capacity expresses following? Maximum inspiration followed by maximum expiration is vital capacity. Plateau phase is due to calcium influx. Rapid in sodium is depolarization. Tricuspid valve close as isovolumetric ventricular contraction, that is C wave on ACV. Rapid ventricular filling phase is isometric ventricular relaxation. Erect or moderate exercise. Erect or moderate exercise on oxygen and carbon dioxide increases PO2. Erect or moderate exercise of oxygen, increase oxygen, increase carbon dioxide. Ventricular repolarization T wave, ventricular depolarization P wave, atrial depolarization is P, ventricular repolarization P, atrial depolarization no wave, ventricular depolarization is QRS, atrial fibrillation absent A. Complete heart block canon A wave because there is Valsa Omaima effect increases thoracic pressure. Normal stroke volume around 70 ml. Stroke volume 70 ml is stroke volume is equal to end diastolic volume minus end systolic volume. Controlled exercise will increase cardiac output by increasing preload and heart rate. Patient with tension pneumothorax decrease cardiac volume stress, decreases ventricular return. Post-collection physiology to fatty meal decreases rate of bile flow after meals. Immediate post-splenectomy CBC changes increase platelet thrombocytosis, as well as bodies, hens bodies, all oval jolly bodies are seen. Autonomic event that increase GI motility. Autonomic GI motility, parasympathetic stimulation. Best for measurement GFR is inulin. And renal blood flow is para-aminohippuric acid. Substrate to renin angiotensinogen. Substances induce vasoconstriction is angiotensin 2. More efferent. This is again on efferent. Water absorption occurs in descending loop of Henle. Water reabsorption in collecting duct. Water absorption descending. And GIT jejunum. Patient taking Lasix, furosemides, osmolarity, descending lobe. Which coagulation factor are not involved in extrinsic pathway, affect intrinsic only? Factor 9. Patient has bleeding for tooth extraction, hemophilia. Hemarthrosis, again hemophilia 8. Increase FDP, DIC. Main pathway for coagulation cascade is extrinsic. Lab test for extrinsic is PT. Gene mutation affecting DNA replication. Phase of cycle is S. Very important Cori cycle for hepatocytes. Cori for hepatocytes and muscles. Old female on wheelchair, muscle loss, atrophy. First physiological response to hypothermia, vasoconstriction. Center of hypothalamus is center. Post gastrectomy, anemia, vitamin B12, pernicious anemia. Alcoholic thiamine deficiency. Pellagra B3 deficiency. Ecchymosis, vitamin K. Dry eye, vitamin A. Night blindness. Dermatitis, riboflavin. Neuropathy, pantothenine B6. Convergent glossitis B6. Needed formation of collagen, vitamin C, bruising. Neural tube defect, folic acid. Renin product, angiotensin. Angiotensin. Drug inhibit renin, beta blocker. Efferent arterial vasoconstriction receptor, ADH and spironolactone act on collecting duct, ADH. Furosemide act on ascending loop of Henle. Thiazide distal converter, thiazide, DCT. Ascending furosemide, spironolactone and ADH collecting duct. Aldosterone acting site mainly aldosterone, distal, aldosterone, and EDH and collecting aldosterone on distal convoluted. Mannitol action proximal, mannitol. Decrease gastric acidity, prostaglandin A2. Increase gastric acidity, gastrin, histamine, vagus. Three things. Vagotomy will affect gastric. How? Reduce gastric section, reduce gastric emptying. Gastric emptying is reduced. Gastric acid inhibitory peptide, GIT, somatostatin and secretin. Octetroid. Action of contraction, hypercoagulable state, protein C and S deficiency, TI. Effects factors 5 and 8. Patient antiphospholipid serum, repetitive DVT, pulmonary embolism, anticardiolipin antibody, primary hypothyroidism, adenoma, Barrett's esophagus, metaplasia, goblet cells, columnar, normal epithelium is pseudostratified squamous. Renal transplant, tertiary hyperplasia, hypercalcemia, secondary due to chronic disease, hypocalcemia, decreased calcium. Duodenum absorb ferric iron, jejunum absorb vitamin C, folic acid, ileum absorb B12. Delayed gastric emptying, jejunostomy and hypothyroidism, glucose absorbed in kidney, insulin transport, proximal convoluted. Anxiety with hormone releases catecholamine from medulla, predominant cell in acute inflammation, neutrophils, predominant cell in chronic inflammation, macrophage, phagocytosis, opsonization, case eating is tuberculosis, syphilis, non-case eating, sarcoidosis, Crohn's, wood dust, maxillary adenocarcinoma, asbestosis, mesothelioma, beta-naphthalene, aniline, benzene, rubber, all they cause cancer of the bladder, transitional cell carcinoma, vinyl chloride, liver, angiosarcoma. Effect of corticosteroids, salt and water retention may be osteoporosis. 3 blood distribution to the organ, brain 15, kidney GI 20 and liver is kidney GI 6% is heart and 3%. COPD, lungs 10 to 15. Increase functional residual capacity. Biopsy from lymph node, TB patient, epithelioid cell, macrophages, giant cells. Types of amyloid rheumatoid, AA and AL in multiple myeloma. Brown segment, ipsilateral pain, motor and lateral pain, temperature. Hyperhidrosis during surgery, cut whatever T1, which is T1 patient suffer from Horner syndrome. Patient with aphasia, upper limb weakness, aphasia, Broca's area, upper limb weakness, middle cerebral artery. Post-operative gustatory sweating, freeze syndrome, heating, parasympathetic develop into sweat glands. Auriculotemporal nerve, which has sympathetic, but their parasympathetic goes. Sympathetic are sweating. Resting tremors, cerebral ataxia, cogwheel rigidity, basal ganglion, spastic paralysis, upper motor, flacidity, lower motor. Most common cause of Berry's aneurysm is congenital polycystic kidney. Berry's polycystic kidney. Most common cause of secular aortic aneurysm, atherosclerosis. Patient tall, female, collapse, aortic dissection, aortic aneurysm, Marfan syndrome. Patient with left leg palsy, injury to anterior cerebral artery, left lower artery, lower limb palsy, anterior cerebral. Most common brain tumor in children, osteocytoma, glioblastoma. Hematomesis in patient in ICU under ventilation due to intracranial Cushing's, burn in unit, curlings, frontal periorbital edema, cavernous sinus. Patient felt on head 2 weeks later, symptom develop, subdural hematoma, renal transplant, calcium, high calcium, low phosphate, high ALP, tertiary, removal of pituitary gland, following removal of pituitary gland, which of the following will occur? Lack of thyroid hormones. Hypocholesteremia, hypothyroidism. Causing gynecomastia, spironolactone, protonpump, cimetine, digoxin, Disco. Patient with nocturia, diabetes insipidus, fasting 7, postprandial diabetes mellitus. Hypertension patient, persistent pheochromocytoma, MEN2, high aldosterone and sodium but low potassium. Cons, CONN, increase sodium, decrease potassium. 2N is increase. High cortisol and sodium but low potassium. Cushing is opposite. Low sodium, high potassium. Sodium low. Additions, decrease sodium, increase potassium. Addition. Cushing disease is pituitary Cushing syndrome. If you point it, identify restrictive fibrosis, obstructive asthma. Non-smoker has peripheral lung tumor, adeno, peripheral non-smoker. Pancoast, T1 root compression. Pulmonary embolism with UC, embolism ECG, T wave in lead 3. Phallostatology. Left ventricular hypertrophy. Cyanotic. Rule out transmission of great arteries. Truncus arteria. TAPA pathology of Fallot. Cyanotic heart disease. ASD, VSD, coarctation of aorta. Defects in tautology of Fallot. Pulmonary stenosis. 1. Overriding of aorta. 2. Right ventricular hypertrophy. 3. VSD. Peutz-Jeghers, hamartomas polyps. Acute abdomen, high amylase, normal calcium, normal liver function, porphyria. Most diagnostic acute pancreatitis is high lipase. Lipase. Diagnostic of pancreatitis autodigestion is trypsin. Patient with pancreatitis, hyperparathyroidism, likely of MEN. Not normally found in urine is glucose, post-operative high creatinine and urea. Type 1 diabetes, long-standing, reduced perfusion. Enlarged prostate, hyperplasia, wheelchair, leg muscle, atrophy, gastric complication, megaloblastic anemia. Lack of one of the factors leads to intrinsic pathway defect, factor 9 and 11. Family history of repeated abortions, antiphospholipid, protein C deficiency, factor 5-8. All factors are deranged in liver except factor 8. Patient got some drugs and got anaphylaxis, mast cells, eating peanuts, eosinophils, histology of rheumatoid, central necrosis, reduced Sternberg, mechanism of abscess increases permeability. Vasodilator is histamine, vasoconstrictor, prostacyclin, serotonin, myasthenia gravis, antibodies against postsynaptic cholinergic receptors, tumor marker for teratoma and hepatocellular. Alpha fetoprotein for ovarian is 125, pancreasis, breast is C15, BRCA, BSc, seminoma. Anti-porphyria abnormal production of the heme due to increased porphyrin gene, diagnosed by unit test, low prehepatic jaundice, conjugal hemolysis, tracheobronophysia, obstructive jaundice, patient pale stools, post-hepatic, stone color, yellow, dark hemolytic brown mix, Crohn pathology, cobblestone, non-glistening transmural, alternate Krebs, megacolon pseudopolyps, first sclerosing cholangitis, primary sclerosing cholangitis. In pancreatitis, abnormality, hypocalcemia, hypoalbuminemia, hypoxia. Types of gastric lymphoma, non-Hodgkin lymphoma. Celiac disease, herpetomas, rash and gluten intolerance. Pneumobilia phenomena where in gallbladder fistula, bubble in the urine, intravesical fistula, carcinoma tumor, appendix secreting tumor, carcinoma tumor diagnosis, 5 and endolipstic, carcinoma tumor treatment, octetroid, massive ventricular defect, ventricular side wave, pansystolic murmur, ASD patient will have ejection, pulmonary artery regurgitation patient will have early diastolic murmur, mid diastolic murmur, mitral stenosis, patient edema and late ejection, aortic coarctation, diffuse lung problem after pancreatitis, ARDS, lung Patient has spasm after pancreatitis, low calcium, corpuscular hypocalcemia, increased CGT, MLS, alcoholic pancreatitis, types of polyp in juvenile polyp, hamartoma, hypothermia in ECG, J wave. Patient has hyperkalemia in ECG, wide QRX, peak T waves. Patient has hypokalemia, you have T depression. Myocardial infarction, V1 to V4, inferior wall, F, lateral wall. Patient history of familial adenosis polycyst now returns with jaundice and pain stool, obstructive duodenal ulcer, Gardner syndrome, cancer, gastric carcinoma, hypochromic nuclei are due to field maturation of the cells. Patient has mother died of uterine ovarian cancer, Lynch syndrome, kidney small chronic pyelonephritis. Patient had villous polyp, hypokalemia due to excretion of. What is histological picture of single polyp in male old fibrous epithelium? Best describe lactate in myocardial infarction, anaerobic glucose to pyruvate, spina bifida, adaptive response, aplasia, silicate poisoning, respiratory alkali, respiratory acidosis, pulmonary embolism produce ABG abnormality, respiratory alkalosis due to hyperventilation, COPD with APG, respiratory acidosis, diverticulitis cancer, no relation, no prevaginal, Crohn's disease cause polyarthritis, amyloidosis increase in high calcium, primary hyperparathyroidism. Patient has abnormality parathyroidism but Ca is low, secondary calcium is low. Patient has renal transplant, tertiary hypertension, serum osmolarity 275, sodium 125, urine osmolarity 1000, SIDA. Pancolitis is least likely to occur in polyarthritis. Osteomalacia is brother of rickets. Osteomalacia, big brother of rickets. Low calcium, low phosphorus bond. Osteoporosis, calcium, normal calcium but weak bone. Paget's disease, high calcium, alkaline phosphate. Nocturia, thirst, fasting, blood glucose, diabetes insipidus. Glucose, diabetes mellitus. 64 weight, female, skin rash, gluconoma. Insulin dependent history of chest infection, ketoacidosis. Patient with ectopic kidney, adrenal gland, usual site. Adrenal is a normal site. Hyperpigmentation, Addison's disease. Rheumatoid lady, 1 day post-operative hyperkalemia, hypotension, Addison's crisis. Test for Addison's disease, short synactin test. Refractory hypertension, pheochromocytoma. Type 1 versus type 2 respiratory failure. 1 is hypoxemia, 2 is hypoxemia and hypercapnia. Hypoxemia. This is hypoxemia, hypoxia. ARDS pathophysiology, reduced diffusion, common cause, acute pancreatitis. Non-case-eating granuloma sarcoidosis, case-eating tuberculosis. Patient tuberculosis do biopsy macrophages. Obstructive disease was restrictive, normal is 80, more than 80 fibrous. Obstructive disease less. In restrictive disease, FEV1 more than 80 decrease in patient is 36% of the treatment became 75 COPD responding to medication. Tumors of glaucoma, migratory in patient smoker, small cell, smoker, small cell. Mid-thigh swelling after patient calcification, dystrophic calcification, patient parathyroid calcification, metastatic. Patient non-smoker. Adenocarcinoma. Patient has non-smoker, adeno. Patient sodium is low, small cell, the syndrome of inappropriate. Patient painless jaundice carcinoma, painless jaundice, pancreas, extranodal lymphoma affect bone, skin, gastric lymphoma, non-Hodgkin lymphoma. Patient with ACTH lung tumor, squamous cell, myasthenia gravis, thymoma, postganglionic endo. PTI from Asia, patient from Asia, cough, tuberculosis. Hypersensitivity type, 5 types. What are they? 1 acidic, A, B, C, ACID. A is anaphylactic, type 1. E is sting, mast cell, type 2 cytotoxic, type 3 is cell mediated, immunological SLE, all that. Type 4 is delayed, T cell mediated, for 5 is IgG. Patient at high eosinophilia, allergy parasites, anal carcinoma, papilloma 1618, oncogenic marker tested, KRAS, cancer, piliformony, beta 2 microglobin, multiple myeloma, CA13 based alpha fetoprotein, CA teratoma and seminoma. Patient is 30 mediastinal mass, FNA granular, thymoma. Histological changes the following: Morton's neuroma, arthritis, thrombosis, heart walls, dense fibrous rheumatoid nodules, lining of gallbladder, simple columnar epithelium, thymoma cell, heart cells, Cobb cells, parathyroid, oxyphil cells. Most common cause of abscess, staphylococcus, pulp space, staph, paronychia, staph, valvulitis, epidermis, viridans is also there, osteomyelitis, staph, sickle cell with salmonella, sickle cell pneumonia, streptopneumonia, mycotic aneurysm, staph aureus, salmonella more than second most common. Discitis all staph aureus. 3 days delivery, shock syndrome, toxic shock syndrome.